I would like to welcome you to the first in a series of DVD presentations on BackTracks Care Clinics. My name is Dr. Lino Panetta, and I am a chiropractic sports specialist and the clinic director at BackTracks Health Center. This presentation on BackTracks Sub-Acute Low Back Pain Care Clinics has been designed with a specific purpose to provide the community-based family physician with access to a chiropractic consultant to facilitate the integration of evidence-based protocols in the management of subacute low back pain. Low back pain has come to represent a significant challenge in healthcare. A Stats Canada 2010 Community Health Survey found that nearly 20%, 1 in 5 Ontarians, reported having chronic back problems. The cost to our healthcare system exceeds $1.2 billion annually and represents over 11% of patient visits to physicians for NMSK conditions. The most important stat to consider is that 90% of referrals to medical specialists are not surgical candidates. As we will see, our current model needs to change. Pain and pain management is a universal problem in healthcare across Canada and the U.S. In 2010, the Institute of Medicine in the United States was asked by the National Institute of Health to assess the science on pain research, care, and education, and to make recommendations for the future. The findings were released in a June 2011 report titled Relieving Pain in America, a Blueprint, which concluded that 1. Pain represents a national challenge in America, and 2. A complete cultural transformation is necessary to better prevent, assess, treat, and understand pain. BackTracks has included a copy of the IOM report in the background materials on this DVD. The IOM blueprint made several recommendations highlighted on the left side of the slide. While prevention is a hallmark, pain education and self-care are key factors to consider when establishing effective pain management programs. In addition, clinicians involved in the assessment and treatment of pain disorders must better assess the pain patient as a subpopulation at risk. This is critical when considering appropriate management at various stages in the differential diagnosis and options in the appropriate delivery of health care for pain patients. Critical in this movement towards cultural transformation is the need for more collaboration of primary care physicians with pain management specialists and initiatives that support better delivery and coordination of evidence-based care. As we will see in the remainder of this presentation, BackTracks Subacute Low Back Pain Care Clinic is just one such initiative. Utilizing the IOM blueprint, let us consider a best practice approach to the subpopulation of lower back pain patients. This will include how to best promote evidence-based protocols, methods to enhance the collaboration between family physicians and low back pain specialists, and a systematic model to facilitate assessment, management, and delivery with emphasis on self-directed care. Applying this blueprint to a Canadian model, BackTracks will highlight Canadian practice guidelines on low back pain, specifically as it relates to the assessment of red and yellow flags, evidence-based management, which recommends manipulation, mobilization, and active care, and lastly, we will feature the Environics study, which supported a model that included family physician referral to a chiropractic consultant. This DVD also provides background material, which includes Canadian practice guidelines on low back pain. BackTracks has included guidelines from both the TOPS program in Alberta, seen on this slide, and the Institute for Work and Health in Ontario. These guidelines highlight the need for identifying red and yellow flags in the assessment of the low back pain patient, and that progresses the low back pain patient from an education self-directed model of active care with an advanced practice clinician to the referral of the chronic recurrent low back pain patient to a facility-based program that emphasizes the integration of manual therapies, specifically spinal manipulation and mobilization. Also included in the background material of this DVD is the Environics study published in June 2012. This Ontario Ministry of Health and Long-Term Care initiative examined the role of the chiropractic consultant to the community-based family physician in the management of subacute lower back pain. The pilot project proved a resounding success both for the family physician and the low back pain patient. Patients reported a significant increase in satisfaction in both understanding their condition and the benefit of self-care. Family physicians reported a decrease in overall referrals of these same patients for additional diagnostic testing such as MRI and CT, and referral to medical specialists. In a press release which followed the release of this study, both Dr. Robert Haig, OCA's Chief Executive Officer, and Ms. Jan Kaspersky, Chief Executive Officer of the Ontario College of Family Physicians, endorsed the findings of the chiropractic consultant model. As the Ministry of Health and Long-Term Care moves to mandate changes toward evidence-based care for lower back pain, amendments to the OHIP fee schedule have already taken place. This movement of lower back pain patients away from advanced diagnostic imaging took place at the same time that the Ministry of Health and Long-Term Care simultaneously launched the ISAC program. ISAC, also known as the Interprofessional Spine Assessment and Education Clinic, was modeled after the Mississauga, Ontario's Trillium Health Centre Spine Clinic, which included one of our colleagues, Dr. David Dos Santos. Dr. Dos Santos is a chiropractic specialist who provides a consultation, first-line assessment, and reports on the triage of patients referred to the orthopedic surgical spine team at Trillium Health Centre in Toronto. ISAC, another chiropractic consultant modeled program, has established a network of clinics in southern and northern Ontario for family physicians to refer patients with persistent subacute low back pain for further assessment and management by advanced practice clinicians such as chiropractic specialists. BackTracks has provided the ISAC website for more information about this program. Unfortunately, no ISAC clinics were designated by the Ministry of Health and Long-Term Care for Eastern Ontario, and none will be considered until 2014. In keeping with the IOM blueprint, the Canadian Practice Guidelines on Lower Back Pain, and the ISAC model, which facilitates collaboration, education, and self-directed care, BackTracks is pleased to launch the BackTracks Sub-Acute Low Back Pain Care Clinic. This alternative, public-private initiative provides a designated community-based facility for local family physicians for the referral of low back pain patients to a chiropractic consultant. Dr. Lino Panetta and Dr. Carlin Stantz each have over 20 years of clinical experience in the delivery of chiropractic care and evidence-based management of lower back pain. Dr. Panetta is a chiropractic specialist in sports science, and Dr. Stantz is a chiropractic specialist in physical and occupational rehabilitation. Both Dr. Panetta and Dr. Stantz have provided over 2 decades of assessments and reports in their capacity as rostered assessors in the Designated Assessment Center system and in the WSIB Regional Evaluation Center. BackTracks is pleased to serve as chiropractic consultants to family physicians in our community. As indicated by the name, BackTracks Care Clinics is not designed to provide facility-based care, but to serve family physicians as chiropractic consultants in the assessment, rehabilitation, and education for subacute lower back pain. The 3 fundamentals in our program includes an evidence-based assessment which will screen for red and yellow flags, comprehensive reports to the referring physician with recommendations in regard to the need for community-based resources for self-care, facility-based manual therapy, and, where indicated, psychosocial barriers to recovery. And lastly, consultation with the patient on the need for self-directed care and exercise. Funding for our services is not provided through the Ministry of Health and Long-Term Care, but is resolved by a private-public initiative. While over 80% of Ontarians have extended healthcare coverage for chiropractic services, less than 10% of the population access the care of a chiropractor on an annual basis. This means that the vast majority of your patients will have little or no out-of-pocket expenses when referred to BackTracks Care Clinics for the assessment and recommendation in the management of lower back pain that emphasizes the need for education and self-directed care. Unlike the referral to medical specialists, access to BackTracks Care Clinics can typically be provided within 1 week of family physician referral. Consultation reports to physicians follow within 1 week of a completed assessment. In addition, BackTracks Lower Back Pain Rehabilitation Program has been developed to provide patients with access to instruction in a home-based exercise program that is graduated, personalized, and provided by a certified kinesiologist on site. For more information on BackTracks Lower Back Pain Rehabilitation Programs, we have included a brochure also on this DVD. The indication for referral of low back pain patients to BackTracks chiropractic consultants includes, but is not limited to, subacute low back pain that persists beyond 4 to 6 weeks, a limited benefit with an initial trial of analgesics, and a patient unable to return to full activities of daily living, or who remains limited in return to work with modifications and/or pacing. For more information on the referral of a specific patient to BackTracks, you may contact Dr. Panetta or Dr. Stantz directly during regular office hours. Some of the key benefits to the patient from referral to BackTracks care clinics comes directly from the collaboration between the family physician and the chiropractic consultant. This includes a consistency to evidence-based protocols, increased access to an assessment with a pain specialist, and timeliness of reports to the referring physician, and a patient-centered care model with emphasis on education and self-directed care and exercise. The result? Improved patient outcomes. Similarly, some of the key benefits to the physician from referral to the BackTracks care clinics comes directly from the collaboration between the family physician and the chiropractic consultant. This includes reduced wait times for referrals and reports, efficiency in the implementation of evidence-based protocols for low back pain patients, which translates into increased patient roster size while maintaining the highest standard of care, more time for the physician to address complex cases which may require advanced medical imaging and medical specialist referral. The collaboration with a chiropractic consultant in the assessment and management of low back pain truly represents a win-win-win situation. In summary, low back pain is a universal challenge to all healthcare providers that requires a cultural transformation in assessment and management. Studies confirm that a chiropractic consultant is an effective component to facilitate the access and delivery of evidence-based protocols. BackTracks Subacute Low Back Pain Care Clinics is a private, public initiative that is working hard to be your first choice to a chiropractic consultant for local family physicians. I would like to thank you and invite you to learn more about the addition of BackTracks chiropractic consultants to your team of pain management specialists. For more information, or to set up a lunch and learn for your clinic of family physicians, please contact BackTracks at the number you see on the screen. To begin to refer your patients to BackTracks Subacute Low Back Pain Care Clinics, we have provided an MD referral form with our DVD package. BackTracks chiropractic consultants look forward to working with you in the assessment and management of low back pain patients in your practice.